I'm just going to give you 2 or 3 minutes just to get the proceedings off today. Now, I must admit I'm feeling a little bit intimidated here because there's all these iPads, iPods, computers, techies, and I've got a piece of paper here in my hand and I'm even being videoed, so forgive me if I'm feeling rather anxious and intimidated here just as I give a quick start off to the day. And I've just been asked to say a few words as to why I think it is such an important area to work in and to contribute to. That is the area of patient education. So a very quick bit about my background. I come from a GP background, and I remember when I was training as a GP that one of the topics that we were discussing was that patients often forget or misunderstand much of what was said in the consultation. And I remember one paper in particular that I read. It was written in the 1970s, and this is just one paper, but that paper concluded on the study that on average, patients had forgotten what a doctor had told or discussed with them within 5 minutes of leaving the consultation. So what was it, 50% of the content had been forgotten within 5 minutes. So I can remember that being hit home to me. I'll give you a little anecdote of one particular consultation that I remember as a junior hospital doctor when I was training as a GP. I can remember seeing this patient who had a stage 2 Hodgkin's disease. Now, for those who've got a bit of medical knowledge, that's a serious illness, but it's got not a bad prognosis. I mean, it's you know, with treatment, you're likely to do pretty well. So I remember talking to this patient about stage 2 Hodgkin's disease and treatment, etc. Didn't think much more about it. About a week later, a relative of this patient was in the ward, and we got talking, and they said, well, thanks for talking to whoever it was about their condition. I went to the library to look up Parkinson's disease, and I couldn't find anything about stage 2 Parkinson's disease. Now, I was completely flummoxed there. I think I talk quite clearly, even though I'm from the north, but we'd obviously had a complete breakdown in the whole whatever communication there. So I came to agree as a young GP that good clinical practice should include, where appropriate, the giving, or in these days, the pointing to good quality patient education materials, even if the verbal advice is exemplary. And much of my working life has been dealing with providing and hopefully providing good quality patient information as part of my working life as a GP and health information provider. As I mentioned, I primarily come from the GP sort of perspective, and I'd just like to perhaps give 2 or 3 ideas of where I see good quality patient information benefits both the patients and to us doctors and health professionals. Firstly, the patients. Amongst other things, the benefits of good quality patient education. Firstly, it satisfies a hunger. I think it's just generally accepted that most patients want good quality health information. And I think the last time I read about it, what is it, something like 1/3 of all internet searches are for some health or disease related. It might be more than that now. That was the figure I found a while back. Second point is that perhaps counterintuitively, I think research has suggested that good quality patient information actually decreases patient anxiety. I think some doctors would say, oh, you give more patients more information about their disease or their treatments, that it might actually raise their anxiety. But I think research has suggested quite the opposite, that even if the information is not very nice about what you might be having or what treatment you might be getting, I think a well-informed patient, on average, is less anxious. Good information aids recall about advice that you might have given and increases concordance, or the old word for that perhaps is compliance, and that too would benefit a patient. And I think there's some research to suggest that a well-informed, well-educated patient actually may have a better general outcome in their disease. There are factors such as pain scores for people with rheumatoid arthritis go down on average for those who are best educated. And who knows, I think a general prognosis may be improved. From a doctor's perspective, this is me as a GP consulting. What do I get if my patient is well educated and got good education about their illness? Well, self-reliance goes up, and I think there's some research suggesting that things such as repeat consultations for such common conditions like back pain, cystitis, that kind of thing, those who are well educated about their conditions, the repeat consultations go down. So workload may in fact go down. Another benefit I've personally found, I don't know about other doctors here, that if you give out or point people to good quality information as a bit of homework, if you like, one consultation, say, well, here we go, Mr. Bloggs, would you read this between now and when we meet again? When they come back a week or so later about the same condition, the whole quality of the consultation, the whole quality of the experience between doctor-patient is enhanced. We're talking that the questions are more enhanced. It just seems as if the whole thing is improved for both doctor and patient. And something that I've relied on, and I think other doctors have relied on, when one uses a good resource of patient information, perhaps you get familiar with one particular resource, that when you consistently, as part of your consultation, point people to it or issue that bit of information, you can rely on that as a doctor to think, I forgot to tell them about this, I forgot that. But you think, well, at least I know that that bit of information will be included in good quality education. However, all these benefits from patients to patients and doctors rely on the fact that the patient material is good quality. And that's the challenge. I remember reading an editorial in the British Medical Journal 1998 by Angela Coulter. At the time, I think she was head of policy or something at King's Fund, quite a big wig. In her editorial, the editorial was about patient education, and although acknowledging that there was some good stuff around, the editorial was talking about research that had found that a lot of patient education materials at the time were factually incorrect. Some of them were very difficult to read, and quite the converse. Some were so sort of infantile and puerile in their content in an attempt to be readable that it had self-defeating aspects to it. Some of the information was skewed, unbiased, and some missed quite important points. And so basically the editorial, this was in 1998, was a challenge to us health educators and health information providers to up our game, get it better. Now since then, about 10 years or so, I believe, in my opinion, the best producers of patient education have in many instances got much better. In my opinion, I think now there's a plethora of very good patient education materials that you can be found. However, at the same time in that 10 years, the volume of poor and even outrageous stuff that you can find has mushroomed too. So I believe that the quality has gone up, but the volume of the bad stuff has gone wide. And so the challenge for us today is not only to provide excellent patient education material that enhances the patient's journey through their health and illness journeys, and also to improve the consultation, the lot of doctors mixing with patients. The challenge is to maintain and to improve the quality without creating cyberchondriacs, and to do it, and also the challenge is to direct our patients and the people that we deal with to the good stuff. So I hope today we'll learn more about how we can do that.